Question 1. The control framework reveals a certified nursing assistant is assisting a resident with their morning hygiene routine. The resident, who typically cooperates, is now expressing significant distress and refusing to allow the CNA to proceed with a particular part of the routine, stating, "I just don't want you to do that today." The CNA notes no immediate physical safety risks, but observes the resident appears genuinely upset. What is the most appropriate immediate course of action for the certified nursing assistant? Option A. Inform the resident that they must comply with the care plan for their own good and attempt to complete the task by gently but firmly guiding their cooperation. Option B. Gently explain the importance of the hygiene task for their health and attempt to reassure them that it is necessary, proceeding with the task if they remain resistant but calm. Option C. Ignore the resident's verbal resistance and continue with the hygiene routine as planned, assuming they will eventually comply. Option D. Immediately stop the hygiene routine, acknowledge the resident's distress, and ask them to explain what is making them uncomfortable, then report the situation to the nurse. The correct answer is B. Gently explain the importance of the hygiene task for their health and attempt to reassure them that it is necessary, proceeding with the task if they remain resistant but calm. Explanation. This scenario is professionally challenging because it involves a direct conflict between a resident's expressed wishes and the perceived best interests of their care, potentially impacting their dignity and autonomy. A certified nursing assistant, CNA, must navigate this delicate situation while adhering to established care plans and regulatory guidelines that prioritize resident rights and person-centered care. Careful judgment is required to balance the resident's right to make choices with the CNA's responsibility to ensure safety and well-being, as outlined by state regulations and facility policies. The correct approach represents best professional practice because it prioritizes open communication and de-escalation. By actively listening to the resident's concerns, validating their feelings, and seeking to understand the root cause of their distress, the CNA demonstrates respect for the resident's autonomy and dignity. This aligns with ethical principles of beneficence and non-maleficence, ensuring that care is provided in a way that respects the individual's wishes as much as possible within safe parameters. Reporting the situation to the nurse allows for a collaborative assessment and intervention, ensuring that the care plan remains appropriate and that the resident's rights are upheld according to state nurse practice acts and facility policies regarding resident rights and grievance procedures. An incorrect approach that involves dismissing the resident's concerns or immediately overriding their wishes without understanding the underlying issues would be professionally unacceptable. This failure to listen and validate can lead to a breakdown in trust and a violation of the resident's right to self-determination, which is a cornerstone of person-centered care and is often explicitly protected by state regulations governing resident rights in long-term care facilities. Forcing a resident to comply with a care activity they are actively resisting, without attempting to understand their reasons or explore alternatives, can be construed as a form of coercion or abuse, violating ethical duties and potentially regulatory mandates regarding resident abuse and neglect. Another incorrect approach, such as ignoring the resident's distress and continuing with the task as if nothing is happening, demonstrates a lack of empathy and a failure to recognize and respond to a resident's expressed needs, which is a breach of professional conduct and a violation of the duty of care. The professional decision-making process for similar situations should involve a structured approach. First, actively listen and empathize with the resident to understand their perspective. Second, assess the situation for any immediate safety risks. Third, explore potential underlying reasons for the resistance or conflict, such as pain, fear, or misunderstanding. Fourth, attempt to de-escalate the situation through calm communication and offering choices where appropriate. Fifth, if the conflict cannot be resolved at the CNA level or if safety is a concern, report the situation promptly to the supervising nurse for further assessment and intervention, ensuring all actions are documented. This process ensures that resident rights are respected, care is person-centered, and regulatory requirements are met. Question 2. What factors determine the appropriate course of action when a resident expresses a desire to refuse a scheduled medication or activity that is part of their established care plan? Option A. The resident's expressed wishes, their assessed capacity to make such decisions, and the CNA's obligation to report to the supervising nurse. Option B. Whether the resident has previously complied with similar requests. Option C. The CNA's personal opinion on the necessity of the medication or activity. Option D. The convenience of the nursing staff in adhering to the routine. The correct answer is A. The residents' expressed wishes, their assessed capacity to make such decisions, and the CNA's obligation to report to the supervising nurse. Explanation. Scenario analysis. This scenario presents a common ethical and legal challenge in nursing care, balancing a resident's autonomy with the facility's responsibility to ensure safety and prevent harm. The certified nursing assistant, CNA, is caught between the resident's expressed wishes and the potential consequences of those wishes. This requires careful judgment, adherence to established protocols, and a deep understanding of both ethical principles and legal mandates governing resident care. The CNA must navigate the resident's right to make decisions about their own care, even if those decisions carry risks, while also fulfilling their duty of care and reporting obligations. Correct approach analysis. The correct approach prioritizes resident autonomy and the established reporting procedures. It acknowledges the resident's right to refuse care or make choices about their environment, provided they have the capacity to do so. By reporting the situation to the nurse, the CNA is fulfilling their professional responsibility to communicate significant changes in a resident's condition or expressed wishes. This allows the licensed nurse to assess the resident's capacity, reevaluate the care plan, and ensure that any decisions made are informed and in accordance with the resident's rights and the facility's policies and procedures, which are themselves rooted in state and federal regulations. This approach upholds the ethical principles of autonomy and beneficence, while adhering to legal requirements for reporting and resident rights. Incorrect approaches analysis. One incorrect approach would be to disregard the resident's wishes and force them to comply with the care plan. This violates the resident's right to autonomy and self-determination, which are fundamental ethical and legal principles in healthcare. Forcing care can lead to a breakdown in trust and can be considered a form of abuse or neglect under various regulations. Another incorrect approach would be to simply ignore the resident's request and continue with the established routine without reporting it. This fails to acknowledge the resident's expressed wishes and potential changes in their condition or preferences. It also neglects the CNA's legal and ethical duty to report significant observations to the supervising nurse, potentially leading to a failure to provide appropriate care or address underlying issues. This could violate regulations concerning resident rights and communication within the healthcare team. A third incorrect approach would be to agree to the resident's request without consulting the nurse, especially if the request poses a safety risk or deviates significantly from the established care plan. This bypasses the licensed nurse's role in care planning and assessment, potentially leading to unsafe practices or a failure to identify and address risks. It also undermines the team-based approach to care mandated by regulations. Professional reasoning. When faced with a resident's expressed wishes that conflict with the care plan or raise safety concerns, a CNA should first assess the situation calmly and respectfully. The next critical step is to communicate the resident's wishes and any observed concerns to the supervising nurse. This allows for a professional assessment of the resident's capacity, a review of the care plan, and a collaborative decision-making process that respects the resident's rights while ensuring their safety and well-being, all within the framework of state and federal regulations governing nursing home care. Question 3. The audit findings indicate that a certified nursing assistant, CNA, was caring for a resident who reported, "I just feel so weak today, like I could fall over." The CNA's response to this resident's complaint is being evaluated for adherence to best practices and regulatory guidelines. Which of the following actions best reflects appropriate professional conduct in this situation? Option A. Assess the resident's vital signs and report the findings, along with the resident's subjective complaint, to the licensed nurse. Option B. Administer a pain reliever from the medication cart, assuming the weakness is due to discomfort. Option C. Document the resident's complaint of weakness in the chart but take no further immediate action. Option D. Tell the resident that feeling weak is a normal part of getting older and encourage them to rest. The correct answer is A. Assess the resident's vital signs and report the findings, along with the resident's subjective complaint, to the licensed nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to interpret subtle changes in a resident's condition and link them to potential underlying physiological issues. Residents' complaint of feeling weak is subjective and can stem from various causes, necessitating a systematic approach to assessment and reporting. The CNA must balance the need for prompt intervention with the understanding of their scope of practice, avoiding overstepping into diagnostic roles. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing resident safety and effective communication within the healthcare team. Recognizing that generalized weakness can be a symptom of multiple systemic issues, the CNA correctly identifies the need to assess vital signs. This provides objective data that can help differentiate between minor discomfort and a potentially serious medical event. Reporting these findings, along with the resident's subjective complaint, to the nurse allows for a comprehensive assessment and appropriate medical intervention, aligning with regulatory requirements for accurate observation and reporting of resident status. This adheres to the principle of providing safe and competent care, as mandated by CNA certification standards, which emphasize the importance of monitoring and reporting changes in resident condition. Incorrect approaches analysis. One incorrect approach involves dismissing the resident's complaint as a normal part of aging or a minor issue. This failure to investigate a subjective complaint violates the ethical obligation to treat residents with dignity and respect, and to provide attentive care. It also represents a regulatory failure to adhere to standards of care that require CNAs to observe and report changes in a resident's condition, regardless of perceived severity. Another incorrect approach is to immediately administer a medication without a physician's order or the nurse's assessment. This is a significant breach of scope of practice for a CNA and a direct violation of regulations governing medication administration. It poses a serious risk to the resident's safety by potentially administering the wrong medication, dosage, or by masking symptoms that require a different medical intervention. A third incorrect approach is to only document the resident's complaint of weakness without taking any further action or reporting it. This constitutes a failure in the CNA's duty to observe and report. Documentation alone is insufficient if it does not lead to appropriate assessment and intervention by the licensed nursing staff, thereby compromising the resident's well-being and potentially leading to adverse outcomes. This also fails to meet regulatory expectations for active participation in the resident's care plan. Professional reasoning. When faced with a resident's subjective complaint, a CNA should follow a structured decision-making process. First, acknowledge and validate the resident's concern. Second, assess observable signs and symptoms within the CNA's scope of practice, which often includes taking vital signs. Third, report all findings, both subjective and objective, to the licensed nurse promptly. This ensures that the resident receives timely and appropriate medical attention based on a complete picture of their condition, upholding both ethical and regulatory standards of care. Question 4. Regulatory review indicates that a certified nursing assistant is providing care for a resident and notes that the resident's bowel sounds, which are typically active and frequent, are now absent upon auscultation. The resident denies any pain or discomfort. What is the most appropriate course of action for the certified nursing assistant? Option A. Immediately report the absence of bowel sounds to the licensed nurse, as this is a significant change from the resident's baseline. Option B. Attempt to stimulate bowel activity by offering the resident a high-fiber snack. Option C. Document the absence of bowel sounds and continue with routine care as the resident reports no pain. Option D. Inform the resident that absent bowel sounds are not a concern if there is no pain. The correct answer is C. Document the absence of bowel sounds and continue with routine care as the resident reports no pain. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to recognize subtle signs of a potentially serious digestive issue and respond appropriately within their scope of practice. The CNA must balance the need for timely intervention with the understanding of their limitations, ensuring patient safety without overstepping professional boundaries. Accurate observation and clear communication are paramount. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing patient safety and adhering to established protocols for reporting changes in a resident's condition. This aligns with regulatory requirements for CNAs to observe and report, ensuring that a qualified healthcare professional can assess the situation and initiate appropriate medical management. Prompt reporting of changes in bowel function, especially if unusual or accompanied by other symptoms, is a critical aspect of patient care, and falls within the CNA's responsibility to advocate for the resident's well-being. This proactive stance prevents potential complications and ensures continuity of care. Incorrect approaches analysis. One incorrect approach involves ignoring the change in bowel sounds, assuming it is a normal variation. This is a significant regulatory and ethical failure. Regulations mandate that CNAs observe and report changes in a resident's condition. Failing to report a change in bowel sounds, particularly if it deviates from the resident's baseline or is accompanied by other symptoms, can lead to delayed diagnosis and treatment of serious conditions such as bowel obstruction or infection, directly compromising patient safety. Another incorrect approach is to attempt to diagnose the cause of the change in bowel sounds or to administer over-the-counter remedies without a physician's order. This constitutes practicing beyond the scope of a CNA's license and training. CNAs are not authorized to diagnose medical conditions or prescribe medication. Such actions violate regulations governing the scope of practice for CNAs and could lead to harm to the resident. A third incorrect approach is to document the observation but not report it to the nurse. While documentation is important, the primary responsibility is to ensure that the observed change is communicated to the licensed nurse, who can then make a clinical assessment. Failing to communicate a potentially significant finding to the nurse means the resident's care plan may not be adjusted appropriately, leading to a breakdown in the chain of communication and potential patient harm. This is a failure in professional responsibility and interdisciplinary communication, which is a cornerstone of safe healthcare delivery. Professional reasoning. When faced with a change in a resident's condition, a CNA should follow a systematic decision-making process. 1. Observe and assess. Note the specific change, e.g., absent bowel sounds, change in frequency or consistency of stool, abdominal pain. 2. Recall baseline. Compare the current observation to the resident's usual pattern. 3. Consult scope of practice. Determine if the observation falls within the CNA's responsibilities for reporting. 4. Report promptly. Communicate the observation clearly and concisely to the licensed nurse or supervisor. 5. Document accurately. Record the observation and the reporting action as per facility policy. 6. Follow up. Ensure that appropriate actions are being taken by the healthcare team. This process ensures that patient needs are met safely and effectively within the established regulatory framework. Question 5. System analysis indicates that a certified nursing assistant is providing morning care for a resident and observes a new, generalized bluish discoloration of the resident's skin, particularly noticeable on the lips and nail beds. The resident is currently awake and alert, but has not verbalized any discomfort. What is the most appropriate immediate action for the certified nursing assistant to take? Option A. Ask the resident if they are experiencing any pain or difficulty breathing. Option B. Immediately report the observed skin discoloration to the licensed nurse. Option C. Continue with morning care as scheduled, as the resident has not complained of any symptoms. Option D. Attempt to determine if the discoloration is due to a new medication or a change in diet. The correct answer is B. Immediately report the observed skin discoloration to the licensed nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to interpret subtle physiological cues and understand the interconnectedness of body systems. Recognizing that a change in skin color can indicate a systemic issue rather than a localized problem demands a higher level of observational skill and knowledge beyond basic task completion. The CNA must prioritize resident safety and well-being by acting promptly and appropriately when potential distress is observed. Correct approach analysis. The correct approach, which involves immediately reporting the observed change in skin color to the nurse, represents best professional practice. This aligns with regulatory frameworks for CNAs that mandate reporting changes in resident condition, specifically state nurse practice acts and facility policies, which are often guided by federal regulations like the Conditions of Participation for Medicare and Medicaid, require CNAs to observe and report. Ethically, this action upholds the principle of beneficence, acting in the resident's best interest, and non-maleficence, avoiding harm, by ensuring a qualified healthcare professional can assess the situation and intervene if necessary. Prompt reporting allows for timely diagnosis and treatment, preventing potential complications. Incorrect approach is analysis. Reporting the change in skin color only if the resident complains of discomfort is a regulatory and ethical failure. This approach neglects the CNA's responsibility to observe and report objective changes in a resident's condition, regardless of the resident's subjective experience. Many serious conditions can manifest with subtle physical signs before the resident experiences pain or distress, and delaying reporting could lead to significant harm, violating the principle of non-maleficence. It also fails to meet the reporting requirements outlined in CNA training and facility protocols. Attempting to diagnose the cause of the skin color change independently is a significant regulatory and ethical failure. CNAs are trained to observe and report, not to diagnose. Diagnosing is within the scope of practice for licensed nurses and physicians. Attempting to diagnose oversteps the CNA's scope of practice, potentially leading to incorrect assumptions and delayed or inappropriate interventions. This violates regulations that define the CNA's role and responsibilities and could lead to harm to the resident. Ignoring the skin color change, because it is not a common complaint, is a severe regulatory and ethical failure. This demonstrates a lack of vigilance and a failure to recognize that any deviation from a resident's baseline condition warrants attention. Residents may have unique presentations of illness, and ignoring a visible sign of potential distress is a direct contravention of the CNA's duty to observe and report. This inaction could lead to serious adverse outcomes and is a breach of professional responsibility and ethical care. Professional reasoning. When faced with a change in a resident's condition, a CNA should follow a systematic decision-making process. 1. Observe. Carefully note the specific change, e.g., color, temperature, moisture, integrity of the skin. 2. Assess within scope. Perform basic observations as trained, such as checking for pain or other immediate symptoms. 3. Report. Immediately communicate the observed change and any basic assessment findings to the licensed nurse. 4. Document. As per facility policy, follow facility guidelines for documenting observations and reporting. 5. Follow up. Understand the nurse's plan of care and continue to monitor the resident. This process ensures that observations are translated into appropriate actions, prioritizing resident safety and adhering to regulatory and ethical standards. Question 6. Cost-benefit analysis shows that investing time in detailed observation and reporting of subtle changes in a resident's behavior and motor skills, even if they seem minor, can prevent more significant health issues related to the nervous system. A certified nursing assistant observes a resident who typically enjoys social interaction becoming increasingly withdrawn and irritable over the past 2 days. The resident also reports a slight, persistent headache and has been fumbling with utensils more than usual during meals. Considering the potential impact on the nervous system, which of the following actions best reflects appropriate professional judgment and adherence to regulatory guidelines for a CNA? Option A. Advise the resident to rest and drink more fluids, assuming the symptoms are due to fatigue or dehydration, and monitor for improvement over the next few days. Option B. Suggest to the resident that they might be experiencing early signs of a serious neurological condition and recommend they seek immediate emergency medical attention without consulting the nurse. Option C. Document the observations in the resident's chart and inform the supervising nurse of the changes, including the resident's subjective complaints and observed difficulties. Option D. Encourage the resident to snap out of it and participate in activities, believing that social engagement will resolve the behavioral changes. The correct answer is C. Document the observations in the resident's chart and inform the supervising nurse of the changes, including the resident's subjective complaints and observed difficulties. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified nursing assistant, CNA, to interpret subtle changes in a resident's behavior and link them to potential underlying neurological issues, specifically related to the nervous system's function. The challenge lies in recognizing that a seemingly minor change, like increased irritability or difficulty with fine motor skills, could be an early indicator of a more significant neurological event or progression of a condition. The CNA must exercise careful judgment to differentiate between normal age-related changes and symptoms requiring immediate attention, balancing the need for prompt reporting with avoiding unnecessary alarm. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing resident safety and well-being through vigilant observation and timely reporting. This aligns with the CNA's scope of practice, which includes observing and reporting changes in resident condition. Specifically, recognizing that changes in behavior, mood, or motor function can be indicative of nervous system dysfunction, e.g., stroke, worsening of Parkinson, or cognitive decline is crucial. Promptly reporting these observations to the nurse allows for a timely medical assessment and intervention, potentially preventing serious complications or improving outcomes. This proactive approach upholds the ethical principle of beneficence, acting in the resident's best interest, and adheres to regulatory guidelines that mandate reporting of significant changes in a resident's status. Incorrect approaches analysis. One incorrect approach involves dismissing the observed changes as simply a bad day or normal aging. This fails to acknowledge the CNA's responsibility to observe and report changes in the nervous system's function, which can manifest in behavioral or motor alterations. Ethically, this approach violates the principle of non-maleficence, do no harm, by potentially delaying necessary medical care. Regulationally, it could be seen as a failure to meet the standard of care expected of a CNA in monitoring resident well-being. Another incorrect approach is to overreact and immediately assume a severe neurological emergency without sufficient observation or context. While vigilance is important, jumping to conclusions without gathering more information or consulting with the nurse can lead to unnecessary panic and misallocation of resources. This approach, while perhaps well-intentioned, lacks the professional judgment required to assess the situation appropriately and could undermine the credibility of the CNA's observations. It may also cause undue distress to the resident. A third incorrect approach is to attempt to diagnose the specific neurological condition or provide medical advice. CNAs are not licensed to diagnose or prescribe treatment. This oversteps the scope of practice and could lead to incorrect assumptions or actions that are detrimental to the resident. Regulatory frameworks strictly define the CNA's role, and exceeding this scope is a serious professional and regulatory failure. Professional reasoning. Professionals should employ a systematic decision-making process. This involves 1. Observation, carefully and objectively noting any changes in the resident's physical, cognitive, or emotional state. 2. Assessment within scope, considering what these changes might signify in relation to the resident's baseline and known conditions, particularly concerning nervous system function. 3. Reporting, communicating these observations clearly and concisely to the supervising nurse, highlighting the nature of the change and its potential implications. 4. Collaboration, working with the nursing team to ensure appropriate follow-up and care. This process ensures that resident needs are met promptly and safely, adhering to professional standards and regulatory requirements. Question 7. The efficiency study reveals that a particular resident, Mr. Henderson, who has a history of falls, frequently attempts to ambulate to the bathroom independently at night without assistance, despite being offered a bedside commode. The CNA observes that Mr. Henderson's room is well lit, and his call light is within reach. What is the most appropriate course of action for the certified nursing assistant to take to prevent falls while respecting Mr. Henderson's autonomy? Option A. Gently remind Mr. Henderson of the risks associated with independent ambulation at night and discuss with him and his family the benefits of using the bedside commode or requesting assistance, documenting the conversation and any agreed-upon plan. Option B. Inform Mr. Henderson that he is no longer permitted to ambulate independently at night due to his fall history and ensure he remains in bed. Option C. Place a bed alarm on Mr. Henderson's bed to alert staff when he attempts to get up. Option D. Remove the bedside commode from his room to encourage him to use the call light for assistance. The correct answer is A. Gently remind Mr. Henderson of the risks associated with independent ambulation at night and discuss with him and his family the benefits of using the bedside commode or requesting assistance, documenting the conversation and any agreed-upon plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to balance the resident's desire for independence with the facility's responsibility to ensure safety and prevent falls. The CNA must interpret subtle cues, assess environmental risks, and implement interventions that are both effective and respectful of the resident's autonomy. Failure to do so can lead to resident injury, increased healthcare costs, and potential regulatory non-compliance. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a comprehensive, individualized assessment and collaborative intervention. This aligns with regulatory frameworks that mandate resident-centered care and the implementation of evidence-based fall prevention strategies. By involving the resident and their family in the decision-making process, the CNA upholds ethical principles of autonomy and informed consent. Documenting the assessment and interventions is crucial for continuity of care and regulatory compliance, ensuring that the facility's fall prevention program is effectively managed and monitored. This approach reflects a proactive and holistic understanding of fall risk management. Incorrect approaches analysis. One incorrect approach fails to involve the resident in the decision-making process, potentially leading to resentment and non-adherence to safety measures. This violates the ethical principle of autonomy and may contravene regulations requiring resident participation in care planning. Another incorrect approach focuses solely on environmental modifications without assessing the resident's specific needs and mobility, which is an incomplete and potentially ineffective strategy. This could lead to missed opportunities for personalized interventions and may not fully address the root causes of fall risk. A third incorrect approach relies on a single, generic intervention without considering the resident's unique circumstances or the effectiveness of other strategies. This demonstrates a lack of critical thinking and a failure to implement a tailored, evidence-based fall prevention plan, which is a regulatory expectation. Professional reasoning. Professionals should utilize a decision-making framework that begins with a thorough resident assessment, considering physical, cognitive, and environmental factors. This should be followed by a collaborative discussion with the resident and their family to establish personalized goals and interventions. Implementation of evidence-based strategies, continuous monitoring, and clear documentation are essential components of this framework. When faced with conflicting priorities, professionals must weigh the resident's rights and preferences against the imperative to ensure safety, always striving for the least restrictive yet most effective approach. Question 8. Compliance review shows a resident with a history of mild balance issues expresses a strong preference for showering independently to maintain their dignity, but facility policy mandates a bed bath for residents with any balance concerns. The certified nursing assistant is tasked with providing morning care. Which of the following actions best balances the resident's preference with regulatory requirements for safety and care? Option A. Perform a partial sponge bath in the resident's room, as this is a compromise between a bed bath and a full shower. Option B. Assess the resident's current ability to safely manage a shower with adaptive equipment and supervision, and if deemed safe, proceed with a supervised shower. Option C. Allow the resident to shower independently without any modifications or supervision, trusting their stated ability to manage. Option D. Insist on a bed bath as per facility policy, explaining that resident safety is the absolute priority and no exceptions can be made. The correct answer is B. Assess the resident's current ability to safely manage a shower with adaptive equipment and supervision, and if deemed safe, proceed with a supervised shower. Explanation. Scenario analysis. This scenario presents a common challenge in long-term care settings where resident preferences and safety must be balanced. A resident's desire for independence during bathing, even when it presents a potential risk, requires careful assessment and intervention by the certified nursing assistant, CNA. The CNA must uphold the resident's dignity and autonomy while ensuring their physical safety and adhering to facility policies and state regulations regarding resident care and safety protocols. Correct approach analysis. The correct approach prioritizes resident safety and dignity by offering a compromise that respects the resident's preference for a shower while mitigating risks. This involves assessing the resident's ability to safely manage the shower environment, providing necessary assistance and adaptive equipment, and ensuring constant supervision. This aligns with regulatory requirements for providing safe and person-centered care, promoting resident independence within safe limits, and documenting interventions. It upholds the ethical principle of beneficence, acting in the resident's best interest, and respect for autonomy. Incorrect approaches analysis. One incorrect approach involves allowing the resident to shower independently without any modifications or supervision, despite their known balance issues. This violates regulations concerning resident safety and the duty of care. It fails to implement fall prevention strategies and could lead to injury, resulting in a breach of professional responsibility and potential regulatory violations for neglect or inadequate supervision. Another incorrect approach is to insist on a bed bath when the resident strongly prefers a shower and is capable of showering with assistance. This disregards the resident's dignity, autonomy, and preference, which are central to person-centered care. While safety is paramount, completely overriding a resident's wishes without exploring safer alternatives can lead to resident distress and a violation of their right to make choices about their personal care. It may also contraindicate facility policies that promote resident independence and choice. A third incorrect approach is to perform a partial bath in the resident's room instead of a shower, without a thorough assessment of their ability to shower safely. This is a compromise that may not adequately address the resident's desire for a full shower experience and may still not be the safest or most appropriate solution if the resident's needs are not fully understood. It lacks the systematic assessment required to determine the most suitable bathing method and level of assistance. Professional reasoning. When faced with a resident's preference that conflicts with safety concerns, a CNA should follow a structured decision-making process. This involves 1. Actively listening to and acknowledging the resident's preference. 2. Conducting a thorough assessment of the resident's physical and cognitive abilities, including their balance, strength, and understanding of safety precautions. 3. Identifying potential risks associated with the preferred activity. 4. Exploring adaptive equipment or modifications that can reduce risks, e.g., shower chair, grab bars, non-slip mats. 5. Determining the appropriate level of assistance required. 6. Communicating the plan clearly to the resident and obtaining their consent. 7. Implementing the plan with vigilance and documenting all interventions and observations. If the risks cannot be adequately mitigated, the CNA must explain the reasons to the resident and explore alternative care plans, involving the nurse or other healthcare professionals as needed. Question 9. Process analysis reveals that a certified nursing assistant working the night shift notices smoke emanating from a hallway and hears a fire alarm sounding intermittently. What is the most appropriate immediate course of action according to standard U.S. healthcare facility fire safety regulations and best practices? Option A. Open all hallway windows to ventilate the smoke and wait for further instructions from the fire department. Option B. Immediately begin alerting other staff and residents and prepare for evacuation or sheltering in place as per the facility's fire safety plan. Option C. Proceed to the nursing station to find the supervisor and await their direction on how to respond. Option D. Attempt to locate the source of the smoke to assess the severity of the fire before taking any other action. The correct answer is B. Immediately begin alerting other staff and residents and prepare for evacuation or sheltering in place as per the facility's fire safety plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate decisive action in a high-stress situation where the safety of vulnerable residents is paramount. The certified nursing assistant, CNA, must quickly assess the situation, prioritize actions based on established emergency protocols, and communicate effectively, all while managing their own potential fear or panic. The presence of a fire alarm and smoke necessitates a rapid response that balances resident evacuation with the need to avoid unnecessary risks. Correct approach analysis. The correct approach, which involves immediately initiating the facility's fire safety plan by alerting others and preparing for evacuation, represents best professional practice. This aligns with regulatory frameworks such as those established by the Centers for Medicare and Medicaid Services, CMS, in the U.S., which mandate comprehensive emergency preparedness plans for healthcare facilities. These plans typically include specific procedures for fire emergencies, emphasizing resident safety through timely evacuation or sheltering in place as appropriate, and clear communication channels. Ethically, the CNA has a duty of care to protect residents from harm, making immediate, protocol-driven action the most responsible course. Incorrect approaches analysis. One incorrect approach would be to first attempt to locate the source of the smoke before initiating any evacuation or alarm procedures. This is a regulatory failure because it deviates from established emergency protocols that prioritize immediate life safety actions. Ethically, it demonstrates a lapse in judgment by potentially delaying critical life-saving measures and exposing residents to greater risk. Another incorrect approach would be to only open windows to ventilate the area without activating the alarm or preparing for evacuation. This is a significant regulatory failure, as it bypasses mandatory reporting and alarm activation procedures. It is also an ethical failure because it fails to adequately protect residents who may be unable to self-evacuate and could be overcome by smoke or flames. A third incorrect approach would be to wait for instructions from a supervisor before taking any action, even with visible smoke and an activated alarm. This is a regulatory failure because emergency protocols typically empower CNAs to initiate immediate life-saving actions in such circumstances. Ethically, it represents a dereliction of duty, as the CNA's primary responsibility is the immediate safety of the residents under their care. Professional reasoning. Professionals should employ a decision-making framework that prioritizes the established emergency preparedness plan. This involves recognizing the signs of an emergency, immediately activating the facility's alarm system, notifying appropriate personnel, and initiating resident evacuation or sheltering procedures as dictated by the plan. Clear communication, adherence to protocols, and a focus on resident safety are the cornerstones of effective emergency response. Question 10. Cost-benefit analysis shows that investing in thorough vital signs measurement and interpretation training for certified nursing assistants yields significant benefits in early patient condition assessment. But what is the most critical factor to consider when interpreting a patient's temperature reading that falls slightly above their established baseline? Option A. The patient's individual baseline and any accompanying signs or symptoms of distress. Option B. The ambient room temperature and whether the patient has recently been active. Option C. The general normal temperature range for the adult population. Option D. The accuracy of the thermometer used and the calibration of the vital signs machine. The correct answer is A. The patient's individual baseline and any accompanying signs or symptoms of distress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified nursing assistant, CNA, to not only accurately measure vital signs, but also to interpret subtle changes and understand their potential implications for patient well-being. The challenge lies in recognizing when a deviation from a patient's baseline or a normal range warrants immediate attention and reporting, rather than simply recording the number. This demands a level of clinical judgment beyond rote measurement. Correct approach analysis. The correct approach represents best professional practice because it aligns with the fundamental ethical and regulatory obligations of a CNA to provide safe and effective patient care. Accurately measuring vital signs is a core competency, and understanding their significance allows the CNA to identify potential patient deterioration. Reporting abnormal findings promptly to the supervising nurse is a critical safety measure, ensuring timely medical intervention and preventing adverse outcomes. This adheres to the CNA's scope of practice and the principle of patient advocacy, as outlined in most state nurse practice acts and facility policies, which mandate reporting changes in patient condition. Incorrect approach is analysis. One incorrect approach involves consistently recording vital signs within the normal range without considering the patient's individual baseline or recent trends. This fails to recognize that a patient's normal can differ from population averages and that a significant change from their personal baseline, even if still within a broad normal range, could indicate a problem. This approach violates the ethical duty to observe and report changes in a patient's condition and could lead to delayed diagnosis and treatment, contravening regulations that emphasize patient safety and accurate documentation. Another incorrect approach is to dismiss a slightly elevated temperature as insignificant, assuming it is due to environmental factors or minor patient activity. This demonstrates a lack of understanding of how even small deviations can be early indicators of infection or other serious conditions. It represents a failure to exercise due diligence in patient assessment and reporting, potentially violating regulations that require CNAs to report any observed changes in a patient's status that could affect their health or safety. Third incorrect approach is to rely solely on automated vital sign machines without performing manual verification or observing the patient for other signs of distress. While technology is valuable, it is not infallible, and a CNA's direct observation and assessment are crucial. Over-reliance on machines without clinical correlation can lead to missed critical findings if the machine malfunctions or if the patient exhibits symptoms not captured by the device. This can be considered a breach of professional responsibility and a failure to adhere to best practices in patient monitoring, which often include a requirement for skilled observation and critical thinking. Professional reasoning. Professionals should approach vital sign measurement with a mindset of continuous assessment and critical thinking. This involves 1. Understanding the patient's baseline and typical vital sign ranges. 2. Accurately performing the measurement using appropriate techniques. 3. Interpreting the measured values in the context of the patient's overall condition, recent changes, and any reported symptoms. 4. recognizing deviations from the baseline or normal ranges that warrant further investigation. 5. Promptly and accurately reporting significant findings to the supervising nurse, providing clear and concise information. This systematic approach ensures patient safety and facilitates timely and appropriate medical care. Question 11. Stakeholder feedback indicates that some certified nursing assistants are encountering challenges when assisting patients with dressing and undressing, particularly when a patient has a wound dressing that needs to remain intact. A patient who has recently undergone a minor surgical procedure on their arm and has a sterile dressing in place insists on dressing themselves, stating they feel fine and want to maintain their independence. The CNA is aware that the dressing is crucial for preventing infection and promoting healing as per the patient's care plan. What is the most appropriate course of action for the certified nursing assistant in this situation? Option A. Ignore the patient's request and proceed with dressing them as usual, assuming they will eventually comply. Option B. Explain to the patient the importance of the dressing for wound healing and infection prevention, and offer to assist them in a way that protects the dressing, such as helping with clothing that does not directly pull on the dressing. Option C. Firmly tell the patient they cannot dress themselves due to the wound dressing and proceed to dress them without further explanation. Option D. Allow the patient to dress themselves completely, trusting their judgment that they can manage the dressing without dislodging it. Correct answer is B. Explain to the patient the importance of the dressing for wound healing and infection prevention, and offer to assist them in a way that protects the dressing, such as helping with clothing that does not directly pull on the dressing. Explanation. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to balance the patient's immediate need for comfort and dignity with the need to maintain the integrity of a wound dressing. The patient's desire to dress independently, while commendable for promoting autonomy, directly conflicts with the clinical requirement to protect a surgical site. The CNA must exercise sound clinical judgment, prioritizing patient safety and adherence to the care plan over the patient's potentially misinformed preference. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the established care plan, which is rooted in regulatory requirements for infection control and wound management. By explaining the necessity of the dressing and offering assistance, the CNA respects the patient's autonomy while ensuring the wound is protected from contamination and further injury. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it adheres to facility policies and state regulations that mandate CNAs to follow care plans and report any deviations or concerns to the supervising nurse, thereby preventing potential complications like infection or delayed healing. An incorrect approach that involves allowing the patient to dress without regard for the wound dressing fails to uphold the CNA's responsibility to prevent harm and follow the care plan. This could lead to the dressing becoming dislodged, contaminated, or the wound being exposed to further trauma, violating regulations related to patient safety and infection control. Another incorrect approach, such as forcefully dressing the patient without explanation, disregards the patient's dignity and right to self-determination, potentially causing distress and eroding trust, which is contrary to ethical care standards and patient rights. Finally, ignoring the patient's request and proceeding with dressing without communication or explanation is a failure in professional communication and patient-centered care, potentially leading to patient dissatisfaction and a breakdown in the therapeutic relationship, and failing to address the patient's expressed need for independence. Professional decision-making in such situations involves a rapid assessment of the patient's condition and needs, a clear understanding of the care plan and its rationale, and effective communication. The CNA should first assess the patient's ability to safely perform the task. If there is a conflict between the patient's desire and the care plan, the CNA must communicate the rationale behind the care plan, explain the risks of noncompliance, and offer appropriate assistance or alternative solutions that still meet the clinical objectives. Escalation to the supervising nurse is crucial if the patient remains insistent or if the CNA is unsure about the best course of action. Question 12. The efficiency study reveals that certified nursing assistants are experiencing challenges in effectively managing resident pain. A resident reports experiencing a sharp, stabbing pain in their lower back. The CNA observes the resident shifting uncomfortably in their chair and grimacing slightly. Which of the following actions best reflects best practice for a certified nursing assistant in this situation, adhering to regulatory guidelines and ethical principles. Option A. Administer a prescribed pain medication from the resident's medication cart without consulting the nurse, assuming it will alleviate the pain. Option B. Document that the resident complained of back pain but take no further action or report it to the nurse, as it is not within the CNA's direct responsibility to manage pain. Option C. Tell the resident that since there are no visible signs of injury, the pain is likely not severe and encourage them to try and ignore it. Option D. Ask the resident to describe the pain in more detail, noting its location and intensity, and then offer to assist them with repositioning or a gentle back rub, while also preparing to report the findings to the nurse. The correct answer is D. Ask the resident to describe the pain in more detail, noting its location and intensity, and then offer to assist them with repositioning or a gentle back rub, while also preparing to report the findings to the nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nursing assistant (CNA) to balance the resident's subjective experience of pain with objective observations and established care protocols. The resident's verbal report of pain is paramount, but the CNA must also consider nonverbal cues and the effectiveness of interventions. The challenge lies in accurately assessing pain, implementing appropriate techniques, and documenting them effectively, all while respecting the resident's autonomy and dignity. Correct approach analysis. The correct approach prioritizes the resident's self-report of pain and involves a systematic assessment and intervention process. This aligns with the fundamental ethical principle of respecting resident autonomy and the regulatory requirement to provide care that addresses the resident's needs. By asking clarifying questions about the pain's characteristics and location, the CNA gathers crucial information for effective pain management. Implementing non-pharmacological interventions first, as appropriate for the resident's condition and preferences, is a best practice that minimizes reliance on medication and respects the resident's overall well-being. Promptly reporting the pain and the implemented interventions to the nurse is essential for continuity of care and allows for further medical assessment and potential pharmacological interventions if needed. This approach adheres to the CNA's scope of practice, which includes observing and reporting resident conditions and implementing care plans under the direction of a licensed nurse. Incorrect approaches analysis. One incorrect approach involves dismissing the resident's pain report because there are no visible signs of injury. This violates the ethical principle of beneficence and the regulatory expectation that residents' reported symptoms are taken seriously. Pain is a subjective experience, and a lack of visible signs does not negate its existence or the resident's suffering. Another incorrect approach is to immediately administer pain medication without further assessment or reporting to the nurse. This bypasses the CNA's role in initial assessment and reporting, potentially leading to inappropriate medication use or masking symptoms that require further medical evaluation. It also fails to consider non-pharmacological interventions that might be equally or more effective and safer for the resident. A third incorrect approach is to focus solely on documenting the resident's complaint without taking any action or reporting it. This demonstrates a failure to provide direct care and to advocate for the resident's needs, which is a core responsibility of a CNA. It neglects the ethical duty to alleviate suffering and the regulatory requirement to respond to resident needs. Professional reasoning. CNAs should approach pain management by first actively listening to and validating the resident's experience. They should then gather more information about the pain using open-ended questions, observing for nonverbal cues, and assessing the pain's impact on the resident's function. Based on this assessment and the resident's care plan, the CNA should implement appropriate non-pharmacological interventions. Crucially, the CNA must then report their findings and the interventions to the licensed nurse, who will determine the next steps, which may include pharmacological interventions. Documentation should accurately reflect the resident's pain, the interventions provided, and the resident's response. This systematic process ensures resident-centered care, adherence to scope of practice, and effective communication within the healthcare team. Question 13. Governance review demonstrates that a certified nursing assistant is assisting a resident with ambulation. The resident states, "I can do this myself, I don't need your help," but the CNA observes the resident swaying and reaching out for support. What is the most appropriate course of action for the CNA? Option A. Tell the resident that they are not safe to ambulate alone and refuse to assist them. Option B. Leave the resident to ambulate independently as they requested, trusting their judgment. Option C. Perform the entire ambulation task for the resident without further discussion. Option D. Offer to assist the resident by providing a steadying arm or gait belt, and if the resident is still unable to ambulate safely, perform the task for them. The correct answer is D. Offer to assist the resident by providing a steadying arm or gait belt, and if the resident is still unable to ambulate safely, perform the task for them. Explanation. Scenario analysis. This scenario presents a common challenge in basic nursing skills, balancing resident independence with safety and the need for assistance. The Certified Nursing Assistant, CNA, must assess the resident's current ability, understand the risks associated with the task, and implement appropriate interventions to ensure the resident's well-being while respecting their autonomy. The challenge lies in accurately judging when a resident requires assistance, even if they express a desire to perform a task independently, and in communicating this judgment effectively and compassionately. Correct approach analysis. The correct approach prioritizes resident safety and well-being, which are paramount in nursing care, offering assistance and performing the task together, or performing the task for the resident if they are unable, aligns with the CNA's scope of practice and ethical obligations. This approach ensures that the resident's needs are met safely and effectively, preventing potential harm such as falls or injury. It also demonstrates respect for the resident by acknowledging their needs and providing care in a manner that minimizes distress. This aligns with regulatory frameworks that mandate providing care that promotes resident safety and dignity. Incorrect approaches analysis. One incorrect approach involves leaving the resident to perform the task independently despite observable signs of difficulty. This failure to intervene when assistance is clearly needed constitutes a breach of the CNA's duty of care. It directly violates regulations that require CNAs to observe residents for changes in condition and to report or act upon any signs of distress or potential harm. Ethically, it is a failure to uphold the principle of non-maleficence, do no harm. Another incorrect approach is to perform the task entirely for the resident without attempting to involve them or assess their capabilities. While this might seem efficient, it can undermine resident autonomy and potentially lead to a decline in their functional abilities. Regulations often emphasize promoting resident independence and participation in their care to the extent possible. This approach fails to respect the resident's right to self-determination and may not be the most person-centered care. A third incorrect approach is to dismiss the resident's request for assistance or to ignore their expressed difficulty. This demonstrates a lack of empathy and a failure to recognize the resident's needs. It can lead to frustration and a breakdown in the therapeutic relationship. Regulatory guidelines and ethical principles stress the importance of communication, active listening, and responding to resident cues. Professional reasoning. When faced with a resident who wishes to perform a task independently but shows signs of difficulty, a CNA should employ a systematic decision-making process. First, observe the resident closely and assess their current physical and cognitive abilities related to the task. Second, communicate with the resident, acknowledging their desire for independence while gently expressing concerns about safety if warranted. Third, offer specific assistance, such as providing a gait belt, steadying their arm, or breaking down the task into smaller steps. Fourth, if the resident is unable to perform the task safely even with assistance, the CNA must perform the task for them, ensuring their safety and comfort. Finally, document the observation, intervention, and resident's response. This process ensures that care is both safe and respectful of the resident's dignity and autonomy. Question 14. Strategic planning requires a certified nursing assistant to anticipate and address potential challenges in providing personal hygiene and grooming assistance. A resident, Mr. Henderson, who has mild cognitive impairment but is generally cooperative, expresses a strong desire to shave himself using a manual razor, despite having tremors that make his hands unsteady. The CNA observes that Mr. Henderson has a history of minor nicks and cuts when attempting this task independently. What is the most appropriate course of action for the CNA? Option A. Allow Mr. Henderson to shave himself with the manual razor, as he has expressed a clear preference, and document any resulting nicks or cuts. Option B. Inform Mr. Henderson that he is not permitted to shave himself due to his tremors, and that the CNA will handle all his grooming needs from now on. Option C. Immediately take the manual razor from Mr. Henderson and proceed to shave him, explaining that it is for his own safety. Option D. Gently explain to Mr. Henderson that due to his tremors, it would be safer for the CNA to assist him with shaving, offering to use an electric razor which is less likely to cause injury, and then proceeding with the assistance if he agrees. The correct answer is D. Gently explain to Mr. Henderson that due to his tremors, it would be safer for the CNA to assist him with shaving, offering to use an electric razor which is less likely to cause injury, and then proceeding with the assistance if he agrees. Explanation. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to balance a resident's express preference with their observed need for assistance, while also adhering to safety and dignity protocols. The CNA must assess the resident's cognitive and physical capabilities to determine if they can safely and effectively perform the grooming task independently, or if assistance is necessary to prevent harm or ensure proper hygiene. The correct approach represents best professional practice because it prioritizes resident dignity and autonomy while ensuring safety and well-being. By offering choices and involving the resident in the decision-making process, the CNA upholds the resident's right to self-determination. The subsequent gentle redirection and explanation of potential risks, if the resident chooses an unsafe method, demonstrates a commitment to providing care that is both respectful and safe, aligning with ethical principles of beneficence and non-maleficence. This approach also adheres to regulatory guidelines that mandate providing care in a manner that preserves resident dignity and promotes independence to the greatest extent possible. An incorrect approach that involves immediately taking over the task without discussion fails to respect the resident's autonomy and may lead to feelings of disempowerment or frustration. This disregards the resident's right to make choices about their personal care, a fundamental ethical and regulatory requirement. Another incorrect approach, which is to ignore the resident's stated preference and proceed with the task as the CNA deems best, also violates the resident's autonomy and can be seen as paternalistic. This disregards the resident's expressed wishes and can erode trust in the care provider. Finally, an approach that involves forcing the resident to comply with the CNA's preferred method of grooming, without explanation or consideration for their feelings, is a direct violation of resident rights and dignity, and could be considered neglectful or abusive. The professional decision-making process for similar situations should involve a rapid assessment of the resident's current state, including their cognitive ability to understand choices and their physical ability to perform the task safely. The CNA should then engage in open communication, offering choices and explaining the rationale behind any recommended course of action. If the resident's choice poses a safety risk, the CNA must gently and respectfully explain these risks and offer alternatives that meet both the resident's preferences and safety needs. The ultimate goal is to provide care that is person-centered, safe, and promotes the resident's well-being and dignity. Question 15. Benchmark analysis indicates that certified nursing assistants are frequently challenged to balance immediate resident needs with strict adherence to infection control protocols. Considering the regulatory framework for certified nursing assistants, which of the following actions best demonstrates compliance with infection control principles when assisting a resident with toileting, where there is a potential for contact with bodily fluids? Option A. Perform thorough hand hygiene before and after the task, and don clean gloves prior to assisting the resident. Option B. Perform hand hygiene after the task, assuming gloves are not strictly necessary if the resident appears healthy. Option C. Use gloves for the task but skip hand hygiene to save time, as the resident is a long-term care patient. Option D. Assist the resident immediately and perform hand hygiene only if visible soiling is present on the hands. The correct answer is A. Perform thorough hand hygiene before and after the task, and don clean gloves prior to assisting the resident. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare settings, balancing the need for efficient patient care with the absolute imperative of infection control. The certified nursing assistant, CNA, is faced with a situation where a resident requires immediate assistance, but the established protocols for infection prevention, specifically hand hygiene and personal protective equipment, PPE, use, are being overlooked due to perceived time constraints. This creates a conflict between the immediate need of the resident and the long-term safety of the resident, other residents, and healthcare staff. The professional challenge lies in recognizing the potential for harm and prioritizing safety over expediency, even when under pressure. Correct approach analysis. The correct approach emphasizes adherence to established infection control principles, which are foundational to safe patient care and are mandated by regulatory bodies governing CNAs. This involves performing thorough hand hygiene before and after resident contact and donning appropriate PPE gloves, in this case, when there is potential for contact with bodily fluids. This practice directly aligns with the Centers for Disease Control and Prevention, CDC, guidelines and state-specific nurse practice acts, or CNA regulations, which are designed to prevent the transmission of pathogens. By following these protocols, the CNA upholds their ethical responsibility to do no harm and their legal obligation to provide care within the scope of their training and regulatory mandates. This proactive approach minimizes the risk of healthcare-associated infections, protecting vulnerable residents and maintaining a safe healthcare environment. Incorrect approaches analysis. One incorrect approach involves skipping hand hygiene and glove use because the resident appears clean and the task is perceived as quick. This is a direct violation of infection control principles. Regulatory frameworks, such as those outlined by the Occupational Safety and Health Administration (OSHA) and state boards of nursing, mandate universal precautions and standard precautions, which assume all bodily fluids are potentially infectious. Failing to perform hand hygiene or use PPE when indicated creates a significant risk of pathogen transmission, potentially leading to HAIs. This demonstrates a failure to understand or apply fundamental infection control knowledge, which is a core competency for CNAs. Another incorrect approach is to proceed with care without proper hand hygiene or PPE, rationalizing that the resident is a long-term resident and therefore poses less of a risk. This line of reasoning is flawed and dangerous. While a resident may be long-term, they can still harbor and transmit infectious agents, especially if their condition changes or they have underlying health issues. Furthermore, the CNA themselves could be carrying pathogens from other interactions or environments. Regulatory guidelines do not differentiate risk based on the duration of residency. They emphasize consistent application of infection control measures for all residents. This approach demonstrates a lack of understanding of the principles of communicable disease transmission and a disregard for established safety protocols. Professional reasoning. When faced with a situation requiring immediate resident assistance that conflicts with infection control protocols, a CNA should employ a systematic decision-making process. First, they must recognize the potential for exposure and the importance of infection control. Second, they should assess the specific task and determine the necessary PPE and hand hygiene steps. If time is a perceived barrier, the CNA should prioritize these steps, understanding that the brief delay is a critical investment in preventing harm. If the situation is truly emergent and prevents immediate adherence to protocols, the CNA should seek assistance from a supervisor or nurse to ensure protocols are followed as soon as safely possible. The core of professional decision-making in this context is the unwavering commitment to patient safety and regulatory compliance, even when faced with pressure or perceived inconvenience. Question 16. Strategic planning requires a certified nursing assistant to anticipate resident needs while respecting their autonomy. If a resident expresses a strong preference for privacy and indicates they might be able to use a urinal independently, but also has physical limitations that make toileting challenging, what is the most appropriate initial action for the CNA? Option A. Immediately place the resident on a bedpan to ensure efficient care delivery, as their mobility is limited. Option B. Offer the resident a urinal and explain how to use it, ensuring privacy, and then check back to offer assistance if needed. Option C. Delay toileting assistance until a more opportune time for the CNA to provide full bedpan care. Option D. Inform the resident that bedpan care is the standard procedure for their condition and proceed with it. The correct answer is B. Offer the resident a urinal and explain how to use it, ensuring privacy, and then check back to offer assistance if needed. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified nursing assistant, CNA, to balance resident dignity and privacy with the practical need for timely elimination assistance. The resident's expressed preference for privacy, coupled with their physical limitation, creates a conflict that demands sensitive handling. A CNA must assess the resident's immediate needs, their capacity to communicate preferences, and the availability of resources to provide care that is both effective and respectful. Failure to do so can lead to resident distress, potential skin breakdown, and a breach of trust. Correct approach analysis. The correct approach prioritizes resident autonomy and dignity while ensuring essential care is provided, offering the resident a choice in how and when they receive assistance within the constraints of their condition and facility policy, upholds their right to self-determination. This aligns with ethical principles of respect for persons and beneficence, specifically under regulations governing resident rights, e.g. ABRA 87 in the U.S., which mandates resident rights including privacy and dignity. A CNA is obligated to involve the resident in their care planning and execution whenever possible, providing a urinal and ensuring privacy for its use, if the resident can manage it independently or with minimal assistance, is a way to facilitate elimination while respecting their desire for privacy. This approach also considers the resident's physical capabilities and comfort. Incorrect approach is analysis. One incorrect approach involves proceeding with bedpan assistance without further discussion or offering alternatives. This disregards the resident's expressed preference for privacy and their potential ability to use a urinal. This failure violates the resident's right to privacy and dignity, which are fundamental ethical and regulatory requirements for CNAs. It can lead to feelings of shame and powerlessness for the resident. Another incorrect approach is to ignore the resident's request and delay assistance until a more convenient time for the staff. This demonstrates a lack of responsiveness to the resident's immediate needs and can lead to discomfort, pain, and potential health complications such as urinary tract infections or skin breakdown due to prolonged contact with urine. This is a failure in the duty of care and can be considered neglect. A third incorrect approach is to insist on using a bedpan immediately, overriding the resident's preference and potentially causing them significant distress. This approach is authoritarian and fails to recognize the resident as an individual with rights and preferences, can erode the therapeutic relationship and create a hostile care environment, violating ethical principles of respect and autonomy. Professional reasoning. When faced with a resident's express preference that conflicts with immediate care needs or standard procedures, a CNA should employ a problem-solving approach. First, actively listen to and acknowledge the resident's concerns. Second, assess the resident's current condition and their ability to participate in their care. Third, explore all available options that can meet the resident's needs while respecting their preferences and dignity. This might involve offering alternative toileting devices, adjusting the timing of care if feasible and safe, or seeking assistance from a nurse to evaluate the situation further. The goal is always to provide safe, effective, and person-centered care. Question 17. The control framework reveals that a certified nursing assistant is caring for an elderly resident who has developed noticeable swelling in their lower legs and ankles. The CNA recalls learning about the basic structure and function of cells, including how cell membranes and transport mechanisms are crucial for maintaining fluid balance within the body. Considering this knowledge, what is the most appropriate action for the CNA to take regarding this resident's edema? Option A. Report the observed edema to the nurse, noting its location and extent, as it could indicate a disruption in cellular fluid balance. Option B. Assume the edema is a normal consequence of aging and continue with routine care without reporting it. Option C. Apply a warm compress to the swollen areas to promote comfort and circulation without informing the nurse. Option D. Suggest to the resident that they try to elevate their legs themselves when they feel tired without documenting or reporting the swelling. Correct answer is A. Report the observed edema to the nurse, noting its location and extent, as it could indicate a disruption in cellular fluid balance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified nursing assistant, CNA, to interpret a patient's subtle physiological changes and relate them to underlying cellular function. The CNA must move beyond simply observing symptoms to understanding the potential cellular basis of those symptoms, demonstrating a critical thinking skill that is essential for patient safety and effective care. The challenge lies in recognizing that a seemingly minor change could indicate a significant cellular dysfunction requiring prompt attention. Correct approach analysis. The correct approach represents best professional practice because it demonstrates an understanding of the fundamental role of cellular function in overall health. Recognizing that edema can be a sign of impaired cellular fluid balance, specifically issues with the sodium-potassium pump or cell membrane integrity, aligns with the CNA's responsibility to report changes that could indicate a worsening medical condition. This proactive reporting, based on an understanding of cellular processes, allows for timely medical intervention and prevents potential complications. This aligns with regulatory guidelines that mandate CNAs to observe and report changes in patient condition, and ethically, it upholds the principle of beneficence by acting in the patient's best interest. Incorrect approaches analysis. One incorrect approach involves dismissing the edema as a normal part of aging or a minor issue. This fails to recognize that cellular functions, such as maintaining fluid balance, can be significantly impacted by disease processes or medication side effects. Ethically, this approach violates the principle of non-maleficence by potentially delaying necessary care. It also fails to meet regulatory requirements for diligent observation and reporting. Another incorrect approach is to assume the cause of the edema without further investigation or reporting. While the CNA may have some knowledge of cellular function, making a definitive diagnosis is outside their scope of practice. This could lead to inappropriate interventions or a false sense of security, potentially delaying appropriate medical assessment. This represents a failure to adhere to professional boundaries and regulatory limitations. A third incorrect approach is to focus solely on external comfort measures without reporting the underlying physiological change. While comfort is important, it does not address the potential cellular dysfunction causing the edema. This approach neglects the CNA's primary responsibility to report significant changes in a patient's condition, which is a core regulatory requirement. Professional reasoning. Professionals should employ a decision-making framework that begins with thorough observation and data collection. This involves noting specific changes in the patient's condition, such as the presence and extent of edema. Next, the professional should access their knowledge base, including understanding basic cellular functions, to hypothesize potential causes for the observed changes. This knowledge should then be used to determine if the observed change is within the expected range for the patient, or if it represents a deviation requiring further action. The framework dictates that any significant deviation from the patient's baseline or expected physiological state must be reported to the appropriate healthcare professional, e.g., nurse, for further assessment and intervention. This process ensures patient safety and adherence to regulatory and ethical standards. Question 18. The monitoring system demonstrates that a resident who has a documented history of falls and requires the use of a walker for ambulation is attempting to walk to the bathroom independently without their walker. The CNA observes this. What is the most appropriate immediate action for the certified nursing assistant? Option A. Verbally remind the resident that they should use their walker and wait to see if they comply before intervening further. Option B. Allow the resident to continue to the bathroom to promote independence as long as they are moving slowly. Option C. Immediately approach the resident, offer assistance, and ensure they have their walker before proceeding to the bathroom. Option D. Go to the nurse's station to report the observation and ask for guidance before approaching the resident. The correct answer is C. Immediately approach the resident, offer assistance, and ensure they have their walker before proceeding to the bathroom. Explanation. This scenario is professionally challenging because it requires a certified nursing assistant, CNA, to balance the resident's desire for independence with their safety and the facility's regulatory obligations. The CNA must assess the resident's current mobility status, understand the limitations and proper use of assistive devices, and ensure that the chosen method of ambulation is safe and effective, preventing falls and injuries. This requires keen observation, critical thinking, and adherence to established care plans and facility policies, which are often guided by state regulations for CNA practice. The correct approach represents best professional practice because it prioritizes resident safety and well-being, which are paramount in healthcare settings and are mandated by CNA regulations. It involves a comprehensive assessment of the resident's needs and capabilities, ensuring appropriate use of assistive devices, and maintaining clear communication with the resident and the nursing staff. This aligns with the ethical duty of care and the regulatory requirement for CNAs to perform tasks within their scope of practice and according to established protocols. An incorrect approach that involves allowing the resident to ambulate independently without proper assessment or supervision, despite a history of falls, represents a significant regulatory and ethical failure. This directly violates the duty to protect residents from harm and could lead to serious injury, resulting in potential legal and disciplinary action against the CNA and the facility. It demonstrates a lack of professional judgment and a failure to adhere to safety protocols designed to prevent falls, which are a common and serious concern in healthcare. Another incorrect approach, such as using an assistive device that is not appropriate for the resident's condition or failing to ensure it is properly adjusted, also poses a safety risk. This could be considered negligence and a failure to provide competent care, contravening the standards expected of a CNA. Professionals should use a decision-making framework that begins with a thorough assessment of the resident's current condition and needs. This includes reviewing the care plan, observing the resident's mobility, and understanding any specific risks or limitations. Next, the CNA should consider the available assistive devices and determine which is most appropriate and safe for the resident. They must then ensure the device is correctly used and that the resident is adequately instructed and supervised during ambulation. Finally, any changes in the resident's condition or any incidents should be promptly reported to the supervising nurse, ensuring continuity of care and appropriate adjustments to the care plan. This systematic approach ensures that resident safety is maintained while promoting their independence as much as safely possible. Question 19. Comparative studies suggest that when a resident expresses a clear desire for a specific care choice, but a family member voices strong objections and claims the resident is not thinking clearly, what is the most ethically and legally sound initial action for a certified nursing assistant, CNA, to take? Option A. Gently encourage the resident to reconsider their choice, explaining the family member's concerns, and then report the situation to the charge nurse. Option B. Directly question the family member about their motivations and try to persuade them to agree with the resident's choice. Option C. Respect the resident's stated preference, assess for signs of confusion or distress, and report any concerns about capacity or undue influence to the charge nurse. Option D. Immediately follow the family member's instruction, assuming they have the resident's best interests at heart and are more knowledgeable. The correct answer is A. Gently encourage the resident to reconsider their choice, explaining the family member's concerns, and then report the situation to the charge nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a conflict between a resident's expressed wishes and the perceived best interests of the resident, as interpreted by a family member. The certified nursing assistant, CNA, must navigate the resident's right to self-determination while also considering potential undue influence or a lack of capacity, which are critical ethical and legal considerations in nursing care. The CNA's role is to advocate for the resident while respecting their autonomy, making careful judgment essential. Correct approach analysis. The correct approach prioritizes the resident's autonomy and right to make decisions about their own care, provided they have the capacity to do so. This aligns with fundamental ethical principles of respect for persons and beneficence, as well as legal frameworks that protect patient rights. The CNA's responsibility is to ensure the resident's wishes are heard and respected, and to report any concerns about capacity or undue influence to the appropriate supervisor or healthcare team. This upholds the resident's dignity and self-determination, which are paramount in nursing care. Incorrect approaches analysis. One incorrect approach involves immediately deferring to the family member's wishes without assessing the resident's capacity or understanding their perspective. This violates the resident's right to self-determination and can be considered a form of elder abuse or neglect if the resident is capable of making their own decisions. It also bypasses the established chain of command for reporting concerns about a resident's care. Another incorrect approach is to dismiss the family member's concerns outright without further investigation. While the resident's wishes are primary, a responsible CNA should not ignore potential signs of distress or coercion that family member might observe. This could lead to a failure to identify a situation where the resident is not truly making a free choice. A third incorrect approach is to directly confront the family member about their motivations or perceived undue influence without involving the nursing supervisor. This can escalate the situation unnecessarily and is outside the CNA's scope of practice, which requires reporting concerns to a licensed nurse or supervisor for appropriate intervention. Professional reasoning. When faced with a conflict between a resident's wishes and a family member's concerns, a CNA should follow a structured decision-making process. First, assess the resident's apparent capacity to understand the situation and make a decision. If the resident appears to have capacity, their wishes should be respected. Second, if there are concerns about the resident's capacity or potential undue influence, the CNA must report these observations to the licensed nurse or supervisor immediately. The licensed nurse will then assess the resident's capacity and determine the appropriate course of action, which may involve further evaluation by a physician or social worker. The CNA's role is to observe, report, and advocate for the resident's well-being and rights within their scope of practice. Question 20. Assessment of a resident's comfort level during repositioning reveals they are experiencing significant pain and express a strong desire to remain in their current position, even though the CNA knows this position increases the risk of pressure injury development. The CNA is aware of the facility's policy on regular repositioning for pressure injury prevention. What is the most appropriate course of action for the certified nursing assistant? Option A. Proceed with repositioning the resident as per the care plan, explaining that it is necessary for their health and safety, and disregard the resident's expressed pain and preference. Option B. Gently explain the importance of repositioning for preventing skin breakdown, and ask the resident if they would be willing to try a slightly different position that might be more comfortable, or if they would like the nurse to be involved in discussing options. Option C. Tell the resident that their comfort is secondary to preventing a serious skin condition, and that they must be repositioned regardless of their pain. Option D. Immediately reposition the resident in the way they prefer to avoid causing further distress, even if it means deviating from the pressure injury prevention protocol. The correct answer is B. Gently explain the importance of repositioning for preventing skin breakdown, and ask the resident if they would be willing to try a slightly different position that might be more comfortable, or if they would like the nurse to be involved in discussing options. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a resident's expressed preference conflicts with the certified nursing assistant's (CNA) understanding of best practice for pressure injury prevention. The challenge lies in balancing resident autonomy and dignity with the professional responsibility to ensure safety and well-being according to established care standards. The CNA must navigate this conflict while adhering to regulatory requirements and ethical principles. Correct approach analysis. The correct approach involves open communication with the resident and the nursing supervisor. This respects the resident's right to make choices about their care, even if those choices seem suboptimal from a clinical perspective. By discussing the resident's concerns and involving the nurse, the CNA ensures that the resident's wishes are heard and that a collaborative decision can be made that prioritizes both comfort and safety, potentially involving alternative positioning strategies or further assessment by the nurse. This aligns with the ethical principle of respecting autonomy and the regulatory requirement to provide person-centered care. Incorrect approaches analysis. One incorrect approach is to ignore the resident's request and proceed with repositioning as initially planned. This disregards the resident's autonomy and dignity, potentially causing distress and undermining trust. It fails to meet the standard of person-centered care, which is a cornerstone of nursing assistant practice and regulatory compliance. Another incorrect approach is to immediately comply with the resident's request without further discussion or consultation. Seemingly accommodating, this could lead to a failure in providing necessary preventative care for pressure injuries, potentially violating the CNA's duty of care and regulatory expectations for safe practice. It bypasses the professional judgment and oversight required in healthcare settings. A third incorrect approach is to dismiss the resident's concerns as unimportant or unfounded. This demonstrates a lack of empathy and respect for the resident's experience and feelings. It is a failure to uphold the ethical obligation to treat residents with compassion and to actively listen to their needs, which is a fundamental expectation for CNAs. Professional reasoning. When faced with a conflict between a resident's preference and a perceived best practice, a CNA should employ a structured decision-making process. This involves 1. Active listening. Understand the resident's concerns and preferences fully. 2. Assessment. Observe the resident's condition and any potential risks. 3. Communication. Clearly and respectfully explain the rationale behind the recommended care, while also acknowledging the resident's input. 4. Collaboration. Involve the supervising nurse to discuss the situation, seek guidance, and collaboratively develop a care plan that respects the resident's autonomy while ensuring safety and adherence to regulatory standards.